Good morning. We are roll number 39 to 40. We are going to explain the knee joint. Knee joint is a complex joint. According to Ayurveda, it is a four-santi. It is formed by tibia, femur and patella. It is a type of condylar synovial joint. Here the two condyles of the femur articulate with the tibia, therefore it is a condylar joint, and it is known as complex because the cavity is divided by two menisci.
Articular surfaces of the knee. The knee joint consists of three articular surfaces: the condyles of the femur, the condyles of the tibia, and the patella. These three forms the articular surfaces of the knee joint.
Ligament of knee joint. First, fibrous capsule. Fibrous capsule has three special features. Anteriorly, it is incomplete due to quadriceps femoris or ligamentum patelli. Posteriorly, it is attached to the intercondylar line. Laterally, it encloses the origin of the popliteus. Second ligament, ligament of patelli, which is also called patellar tendon. It is a continuation of the quadriceps femoris. The thickness is 2.5 cm and it is 7.5 cm long. It attached to the posterior surface of the patella, and below it attached to the smooth upper part of the tibial tuberosity. Next ligament, tibial collateral ligament, which is also called as medial collateral ligament. Location, it lies on the medial side of the knee. Attached the femur to the tibia. Function, it resists the valgus stress, means stabilizing the inner knee. Second ligament, next ligament, fibular collateral ligament, which is also called as lateral collateral ligament. Location, it lies on the outer side of the knee, connecting the femur to the fibular head. Or function, it resists the varus stress, means stabilizing the outer knee.
Cruciate ligaments. There are two types of cruciate ligament: anterior cruciate ligament and posterior cruciate ligament. Cruciate ligaments are thick and fibrous band-like structures. So anterior cruciate ligament, it is found in the intercondylar area of the tibia in the anterior part, and the posterior cruciate ligament, it is found in the intercondylar area of the tibia in the posterior part. The anterior cruciate ligament is taut when the knee is extended, and the posterior cruciate ligament is taut when the knee is flexed.
The topic is blood supply. The knee joint is supplied by anastomosis around it. The chief sources of blood supply are 5 genicular branches of popliteal artery, descending genicular branch of femoral artery, descending branch of the lateral circumflex femoral artery, 2 recurrent branches of anterior tibial artery, and the circumflex fibular branch of posterior tibial artery. Now, next one is the nerve supply. Three nerve supply are there. First, femoral nerve. Through it branches of vasti, especially the vastus medialis. Second, genicular branch of the tibial common peroneal nerves, that is sciatic nerve. And the third is obturator nerve. Through it posterior division.
Movements of knee joint. First movement is flexion. Muscles involved in flexion are biceps femoris, semitendinous and semimembranous. In flexion, the angle between posterior angle between thigh and leg decreases. This is the flexion of the knee joint.
The second movement is the extension movement of the knee joint. In extension movement, the posterior angle between thigh and leg increases. The muscle involved in extension of the knee joint is the quadriceps femoris. The movement is extension of knee joint.
The next movement is medial rotation of flex leg. The muscles involved in it are popliteus, semitendinous and semimembranous. And the action is medial rotation of flex.
The next movement is the lateral rotation of the flex leg. In the lateral rotation of flex leg, muscle involved in biceps femoris. The movement is
So the next movement is locking. Muscles involved in it is vastus medialis. It is standing in attention.
the next movement is unlocking movement, in which the muscle involved is popliteus muscle. Stand at ease. The movement is
Now we will see the clinical anatomy of knee joint. Structurally, the knee is a weak joint because of the articular surface are not congruent. The tibial condyles are too small and shallow to hold the large convex femoral condyles. The femoral patellar articulation is also quite insecure. We will see them factors maintaining the stability of knee joint. There are 4 factors. First one is cruciate ligament, maintain antero-posterior stability. Collateral ligaments maintain side-to-side stability, and various ligament it strengthens the knee joint, and then iliotibial tract which maintains the stability of knee.
Deformities are where the angle between the long axis of thigh and the leg may get abnormally abducted. That is the gemmelling valgum. Here the leg is abnormally adducted, and the second one is gemmelling valgum, where the leg is abnormally adducted. Aspiration of knee joint. Aspiration of fluid is done by passing the needle into the joint at the midpoint of the triangle, which is formed by tibial tuberosity, lateral epicondyle of femur, and the apex of patella.
Good morning everyone, myself Bhavesh Paira, roll number 33, and I am going to explain relations of knee joint. Anterior relation, there are 3, anterior bursa, patellar plexus of nerve, and ligamentum patellae. On posterior side, at middle, there are popliteus vessel, tibial nerve, medial canacular vessels and nerves. On posterior, laterally, lateral head of gastrocnemius, plantaris and common peroneal nerve. And on posterior medially, there are medial head of gastrocnemius, semitendinosus, semimembranosus, and gracialis and popliteus. And on medial side, there are 3, sartoris, gracialis and semitendinosus. And on lateral side, there are 2, bicep femoris and tendon of popliteus. Thank you.